listening to the Pharmacy Podcast Network.
IngeniousRx is a boutique business-to-business consulting firm leveraging deep pharmacogenomics science and clinical implementation knowledge to help pharmacogenomics stakeholders reduce and remove barriers to pharmacogenomics becoming a clinical standard of care in medication therapy management. To learn how your company can partner with IngeniousRx, email Dr. Becky Winslow at beckywinslow711@gmail.com.
This is the PGX for Pharmacists podcast. We believe pharmacists are the best positioned providers to lead in PGX. Pharmacogenomics is the study of how genes affect a person's response to drugs. This relatively new field combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. This podcast is dedicated to pharmacists with an interest in learning more about the data analytics, industry trends, and evidence-based usage of pharmacogenomics. Welcome to PGX for Pharmacists, part of the Pharmacy Podcast Network.
Hi, everyone. My name is Benas Sarami, your host of the PGX for Pharmacists podcast on the largest pharmacy podcast network in the nation and one of the top 20 podcasts in genomics globally. If you're new to the podcast, hopefully you're not, I'm a pharmacogenomics medical science liaison and a mentor to pharmacists. Connect with us on LinkedIn and we can get the conversation going.
And I am Becky Winslow, your co-host for the PGX for Pharmacists podcast. I am a PharmD with, almost 25 years of experience now. Almost 10 years of that experience has been in medical and clinical affairs for pharmacogenomics companies. If you've been listening to Benas and I, you know my pharmacogenomics knowledge and experiences complement Benas's, and that's how we are able to bring our listeners such a comprehensive view of pharmacogenomics. A great way to describe the content Benas and I bring you is that we educate our listeners beyond the PGX certificate program. Mm-hmm. We were once just like you at the end of a pharmacogenomics certificate program and unsure where to go from there.
And really, that is what we wanted to focus on today, about how to get started and the realistic road to what it looks like before you take on this amazing adventure. It is amazing, but we wanted to kind of be realistic. So we have a lot of pharmacists reaching out to us, asking all types of questions, and we wanted to kind of put together the most common questions that we see, such as how do we start our consulting business? How much money can I make? Which CE can I take? Because there's a lot of them out there, so I can learn more. Which lab to partner with? How do I pick a lab? How much can I charge for my service? So those are most common questions. And I'm assuming, Becky, same with you, that we're getting. Absolutely. And we want to kind of address them today so we can reach more people, more of our peers versus the one-to-one conversation that we have. So why are we doing this, Becky? What is our goal? So, today's goal is really, again, to educate our listeners and what to look for when they're starting their consulting business, right?
Great idea. There's so many out there that are seeking out our help. So let's jump right into the nitty gritty and get these guys some help and gals.
Yeah, that's true. So I wanted to kind of start off, Becky, and you let me know if you don't like this, but with the CE, right? So there's a lot of Cs out there, right? You can Google pharmacogenomics CE or PGX certificate program. There's a lot of them out there, and they're all great. They all have their, good and bad, or, pros and cons, right? They range from $300 up to thousands of dollars. So here's how I kind of really talk to patients and tell them to pick from. So looking at the objectives of each of the ones that you're looking at and what you want to learn more. Some of them, you can see they're focused on mental health. Some are focused on oncology. Depending on which realm you want to take it, that will be one of the things you need to look at. And then the cost of the C, I said it ranges from $300 to over thousands, but they have the live version, you got video you can watch, you got the written format that you can read, so many different styles. So how I like to kind of say, cost wise or objective wise to look about it is, compared to pharmacy school. So I don't know if Harvard has a pharmacy school, but let's say you're going to Harvard Pharmacy School or Yale Pharmacy School, if they exist, versus University of Maryland Pharmacy School. These are just examples. So all those are really great schools, but obviously the cost is where they vary, right? The cost of, for example, Yale and Harvard will be a lot more, but hopefully they give you the same kind of information and you learn the same things through the program, right? But then when you come out of that program, just like, again, the pharmacy school, after you get that exposure and experience is where your learning comes from. So Becky, here's a great example. When I first got, I think it was my first day or my first script, I don't remember, at a retail store, I had a proton pump inhibitor. And I don't remember whether it was omeprazole, pantoprazole, but I remember in school we studied once a day dosing, right? So yes. I get this script and it says twice a day. I'm like, oh my God, the clinician's so wrong. It cannot be. I studied it once a day, but I realized in the real world, you can do twice a day and there's a whole bunch of reasons. So those are what I'm talking about. So you really learn the experience of it and what to do as you're coming out, speaking with clinicians, looking at scripts. And so that experience is learned after you attain that CE. So I wouldn't bog down on, oh my gosh, which one I'm going to pick. Look at the objectives. They all should teach the same. Look at how much money you got in your pocket and kind of go from there, but realizing that you learn on the job. And, that is kind of what I would say. And, I've done retail. I've talked a little bit about retail because everyone wants to get out of retail, which is great. I probably would never go back. Right. But I don't really, Becky, and I don't know if you have this experience or not. I don't know if I would ever go. I don't have a regret of not working in that setting because it taught me so much, right? The patient interaction, again, the scripts you get, the clinician interaction I had to have, the prescribing habits, learning the dosing indication, troubleshooting. And then once you're a pharmacist at a store, you're managing people, managing the staff. There's so many things that you learn. I wouldn't trade that experience at all with anything. I probably wouldn't go back, but I don't think I would have been successful and as well-rounded if I hadn't had those experiences. Absolutely. So what are your thoughts there?
Absolutely. I mean, I couldn't agree with you more, Banaz. The PGX certificate programs that are available, they're intended to teach the learner the basics. Just like you said, pharmacy school teaches you the basics, but real world experience is what's going to make you successful in pharmacogenomics, just as being a pharmacist. So the real world experience is really critical to your success. Like you said, you wouldn't go back to retail. I worked in retail. I was a hospital pharmacy director. I worked as a long-term care consultant. And no, I won't go back to those jobs again because I've transitioned into other positions that I absolutely adore. But the clinical and business acumen that I developed in those roles has been priceless to my success as a pharmacogenomics consultant. So for anyone who's considering pharmacogenomics consulting, don't quit your day job. Don't quit your day job. Hang in there. Learn everything you can learn because it's going to be invaluable to you when you are applying what you've learned in that certificate program to the real world. All righty.
Yeah. And, to kind of follow up on that, I say this to a lot of pharmacists I speak with, you learn a lot of exactly those acumen, the skill sets through wherever you are right now. It could be retail, it could be hospital, wherever you are. And then this could be a side hustle, quote unquote. But, understanding when you sit with the patient, you obviously we're experts in doing an MTM, taking health history, doing the MTM. explaining the need for potentially selecting the individuals that may need a genetic testing. What does that look like, and how you determine that? And then you do the testing, right? And you get the results back. Can we sit down with a patient and explain that in the 8th grade level or 5th grade? I don't know which one we call it now, 8th grade, 5th grade.
Yes.
8th grade level. Yeah. Can we, beyond the piece of paper, I call it, beyond the genetic report or piece of paper, can we explain that in a very, basic format to the patient that they can understand? Can we explain that to a clinician that they may be new to the genetic vocabulary and terms beyond what RD report says, and make those recommendations based on our knowledge? Can we do that? So that's part of also having, if you want to do a consulting business in the PGX, that's part of it. So understanding those are also skill sets, those are experiences, those are the clinical knowledge. Can you do all those things, right, Becky?
Absolutely. Like I said, the certificate programs are meant to be the basics. What you need to do to be successful as a consultant is you need to be able to confidently express how to use those test results, how to make them actionable. Otherwise, it's just, it's kind of entertainment. So those skills that you have developed outside of the certificate program, those real world experiences are priceless when it comes down to being a consultant. And not just on the medication therapy management part, but let's just say that you have been tasked with starting a pharmacogenomics program. So maybe your employer, maybe you're not just looking to be a consultant, but maybe your employer has tasked you with being or starting a pharmacogenomics program. Any real world experience that you've had, such as when I was a hospital pharmacy director, I started over 25 different clinical pharmacy programs. And that experience made it so much simpler for me to know how to design a pharmacogenomics program from scratch. So, just to add on to that even if you're not looking to be a consultant, but maybe you're employed and your employer wants you to start a program, those real world experiences are priceless. So get as many real world experiences that you can before you just jump and decide you're going to be a pharmacogenomics program builder.
Yeah, really. And the number one thing to do is understand, I always say this to people I speak with, put yourself in the place of either the patient or the clinician. Since you're talking about, Becky, a clinician or a hospital setting, you're trying to implement the genetics program, let's keep it there. So if I'm a clinician, knowing you're an expert in the field, let's say by now, and want to hire you, why should I hire you when I can hire the next person next door, or another pharmacist that might be another expert, or you're a liability to my practice, my setting, and my patient. So how do I trust what you're saying is correct? So there's a lot of things we miss, I think, when we're our own business person, that it's not just what we want to sell and what we want to produce. What about the other person that has to accept what we're giving them? We have to see if there's value. And I know you talked about this great with when it comes to the business model and marketing research. Right?
Absolutely.
Talk to us about that. I know I always give the coffee shop example, but I want the listeners to listen what you have to say on that, because these are one of the million things we need to think about. Overnight starting in a, let's say, because I've done this before, starting an LLC, putting up your name and website is very easy. You can do this.
That's
overnight.
easy.
The harder part is the other things we're talking about, right?
Yes.
You're welcome to use my coffee shop perfect example, but if you like, but I'm just saying it's mine. I'm just kidding.
And, I'll preface my discussion of business models in which pharmacogenomics can be integrated by saying, I would be dishonest with our entire audience if I said my very first business model that incorporated pharmacogenomics testing was the same business model I have today. And the reason...
So you failed is what you're saying, Becky?
Oh, heck yeah. Oh, my gosh. Oh, my gosh, because...
Let's talk about our failures for a little bit too. So, right?
Yes.
Go for it.
Despite my years of pharmacy management, clinical pharmacy program design and implementation, pharmacogenomics is a different creature in that it has many barriers that other clinical pharmacy programs may not have. So I have had to tweak my business model over the years. Honestly, I started out thinking, oh, I bet doctors are going to love this. Let me go to them. And surely they will pay me to do this. And I was very wrong at that time. That was, 10 years ago or so. And I'm not going to get into the I'm not going to get into all the details.
I want to see what exactly happened.
Yes.
Missing all the juices of the conversation.
That's right. Without me getting into full details of every transition I made, the basic idea is that you have to do market research.
Yeah.
You have to look to see, has any other entity set the precedent for the type of business model that you are anticipating will work? What have you imagined that this pharmacogenomics consulting is going to look like for you?
In your area, in that area.
In your area.
Yeah.
In your area. Who is your target client? Who is going to pay you? It's not just, I think this feels warm and fuzzy and it feels really great for me to offer this. You really have to think hard about who's going to value what you have and whether they're going to pay you to provide this service or not.
Yeah, and we're saying it is valuable, but other people have to see that, right?
Exactly.
To be able to pay the service that you're going to provide, or in addition to the test they have to pay for, in addition to the potential clinicians copay they have to pay for, right? So start.
That's right. Like I said, I felt warm and fuzzy about this. And my first business model, I was helping a laboratory help physicians. I thought physicians are going to greatly uptake the product. And I mean, they did. They believed in the product. I've talked about this with our audience before. We had a payer for the test. The physicians believed in it. But when the lab stopped getting paid for the test, well, then they couldn't afford to pay me anymore. So you always have to think about not only who values your services and who wants to pay you, but is that payment sustainable? Okay. What does that look like over the long term? Are they going to be able to sustain your reimbursements? Because that's very important.
So I noticed that, Becky, you did not mention your failure. So I'm going to mention mine and be more vulnerable than you. So I remember when I first started, this is many years ago, I went into a psychiatric practice and I was so excited, very overly confident, Becky. I knew my stuff, and I sold the psychiatrist on the value of the PGX, right? So I was doing great. And then he said, great. And here's even a little mini office you can work off of. Like, oh my God, I got good. He asked me, I got a couple questions for you. First, how are you getting paid? What's the value in it for me? And 3 questions, not 2. You're a liability to my practice because I have a lot of MPs and MAs working under my license, and you'll be another one. So tell me a little bit more about the other side of it, except the clinical. I'm like, I really got stuck. And I had no answer for him. I was like, so those are great questions. How about I get back to you on that? And I never went back. So Yeah, it was, but that's how I learned, okay, there's another side of it that I didn't
Yes,
think
there
about. It
is.
was just all what Banaz wanted to do. What about on the other side of the receiving people? What does that look like? And how do I even know how much to pay on, put a price on it? And the coffee shop example I say that Becky did not use, thank you, was, the market research is really great that Becky was talking about. It is like if I want to open a coffee shop, but there's Starbucks around me. There's a St. Louis. I live in St. Louis. A bread company or Panera Bread around me, or there's Dunkin' Donut. Why would people come to my coffee shop and pay where they can go to the 3 other ones that are well known? So I got to be able to have a good answer for that. Is it because I'm providing something other people can't? So to be able to open up a business, right? Your own business. Do you have a business plan? I think you talked about this, Becky. Do you have a business plan? What does that look like? There's a lot of pharmacists out there. So what is so special about us that we're going to provide that service? So there's a lot of things that goes into starting up your own business. So there's my failure in coffee shop example on that.
Yep. Well, just to name off my pathway. So, and the failures in between.
Oh, now you want to share? I see.
Yeah,
gotcha.
yeah.
Okay.
So I went from the physicians to self-insured employers who were very vested in improving medication outcomes, to working with producers of pharmacogenomics, whether that be software, tests, et cetera. And I think the important message to my audience here is that I always was willing to tweak my model. I wasn't a black and white thinker that, oh no, this is how I absolutely have to do it because, well, Jane Doe told me this was a great way for me to do consulting or et cetera. I always kept my mind open, and I think what has allowed me to be successful in transitioning through business models in pharmacogenomics is looking for problems that need to be solved. So if you can solve problems, if you can solve problems, people are typically willing to pay you to solve their problems.
That's true. And this comes back to what you were talking about earlier very brilliantly. There's who are your customers? So who are our customers? Let's say I started my LLC tomorrow and took my CE and I knew which one to pick and start my LLC and my company name. And I have a cool website. So, who are my target audiences, Becky?
Absolutely. Who is your target audience? And I'll be honest with you, when I first started out, if you had told me that, one day I would be helping write tests or I'd be one day helping write clinical decision support, I would have laughed because I would have never thought of that.
Yeah. Yeah.
You really have to keep your mind open. And, also getting advice from persons such as ourselves who have traveled this road, who have had to transition. We have a lot of insight on how to avoid the roadblocks that you're inevitably going to encounter.
Yeah. And, reaching out to your customers being not other pharmacists, but patients, right? So they would want to do this test and talk to their clinicians. Your other customers not being pharmacists and being clinicians, because those are the ones who have to actually order the lab tests and be willing to potentially partner with you, right? Or your customers are not other pharmacists, but payers. So because those are the ones going to be actually covering the test for your patients to be able to afford to pay it. So there's I think we have it a little bit backwards. I feel like, Becky.
Yes. I mean, like I said, I think just seeking mentoring from someone who has lived these experiences, has, I would say, in-depth industry knowledge, and can help you navigate around the hurdles. What someone just asked us last week about, does a do I have to have a doctor sign off on the test requisition?
Great question.
I mean, that's a big question. And it comes up quite frequently because sometimes physicians don't want to be in collaborative practice agreements because they consider it to be a liability.
Yeah.
So, those types of questions that can't, or maybe they could be answered in a program, in a certificate program, but it'd probably be a year-long program.
And there are those programs, year-long ones.
Yes, I think they call those masters.
They can be great.
Right. Yeah, like they have master's programs you can take where you might get all of these questions that come up answered in an expert manner by someone who's already researched it because they've already come across it.
Yeah.
Those are the type of questions that we're really great at helping with because like I said, we go beyond the certificate, right?
And the other main question I usually get and answer back is like, I want to start my own consulting, PGX consulting business. Okay, so what does that mean? I ask that question almost that's my second sentence to them is like, what does that mean? Where do you see yourself in a year, 5 years? What does that look like? Well, I want to do MTM and PGX. That's like 90% of the answer. Okay, but what does that look like? Is it with the patient? Is it in an office? Is it in a hospital? Is it just at home? Is it like, how do you expect to get these people advertising? Okay, how? Like, I think the statement is really nice and pretty, and I think that's where we all had our failures. But the action part and the receiving is really difficult. Like it's not. Again, the goal of this is to give you the realistic, true side of it. It is very lucrative and it is a great role. It is a side hustle. You cannot really produce a business to replace an income that potentially I myself or the average pharmacist gets at a retail. It is not that. And you really got to be clear on your goals, figuring out the market research, who's your customers, who's going to pay you and why. There's a lot of little things that go into it. Otherwise, we were saying, the CE, the LLC is a really no-brainer overnight. And there's a lot of little sites that you can learn from to get that information. But beyond that is what we're talking about. Beyond that, how do you have it successful and to continue? Because we really want PGX to stay, right? We want the PGX to stay. We want people to reach out to pharmacists who are drug experts but how do we make that really happen? So we try not to set up people for failure. And also the other important thing, Becky, I think we need to talk about is the outcomes. The goal of us, and I say this with such passion, if you can just see my face, but you can't, is outcomes. What have we done with the PGX space? We can even take you and I, that has moved the needle a little bit forward. Have I helped the patient in the last, let's say, 5 years that I've helped somebody? Have I helped a clinician, do more tests? Have I helped? Like, that is the outcomes I'm talking about. We need more of that. So,
absolutely.
And you're an expert in the reimbursement side of that. That includes insurances getting on board, seeing that there's 50, 100, 2,000 patients that are seeing the benefit. And that's where adoption reimbursement comes from, right?
Absolutely. I can promise you that payers, if they don't see that evidence, there won't be reimbursement. So that's why I always encourage pharmacists who are starting their own consulting to please document your outcomes. And, the great thing about this is that you don't have to do it on your own to make an impact. In fact, working together, we can all together probably make a bigger impact. Be that person that helps run the clinical trial for pharmacogenomics. Be that person that seeks out grant money to study. If you're looking for a payer grant money, look at getting some outcomes published on the economic outcomes of pharmacogenomics. And you're still contributing, you're still being paid as a consultant, and the patient wins in the end. So, Yeah.
Yeah, and you don't have to write your own grant. That's a whole different full-time job there. But I think working with the academia or your own pharmacy school or any school setting, or university setting or hospital setting, I think it's easier to tag along with someone and bring them that hey, let's do this together, and have them do the grant, because there's so much more that goes into grant. That's a whole different
absolutely.
podcast I don't think we want to even touch, but it's not like, oh, let me write a grant tomorrow either.
No,
I'm not saying that, but there's places to go to collaborate with others who've done grant and know how to write it. It's not just what you want to write, it's what the receiver is trying to see on a grant before they pay you all this money. So that's another great route. Thanks for mentioning that. I think we forgot about that. So did we miss anything that's kind of beyond the certificate, but then not much of over,
Yeah, that we could talk for hours, we could talk for days, and
you can
probably
call me Becky after the podcast.
Never run out of things to educate our audience about. So that's what we're trying to help you do. We had some discussions over the holiday, and we were thinking about how we could really impact. We see so many pharmacists who are expressing their interest. Yay, I got my certificate. I'm going to be a consultant. And
that's great.
It seems that maybe that fizzles out for them. So we realize that you guys need help beyond that certificate. And so that's what
that's what we should call it. Beyond
the certificate.
Yeah. Beyond the PGX certificate. I like it. I like it.
Yes. So we'll be bringing you more content beyond the certificate, real world experience. How about that?
I like it. I think I like both.
Maybe we should let the audience vote.
Yeah. Do you think how many pharmacists do you think, I know clinicians probably don't know, but how many pharmacists do you think they know about CPIC that are starting to learn about PGX? If you had to.
Oh gosh. Well, they'll hear about it. They'll at least hear about it in their certificate program.
I hope so. Okay.
Yes.
I was going to say, if you think there's not a lot, then we can kind of touch on maybe what is CPIC and how it came about to be. Maybe not.
That's right. How did it come about?
Yeah.
What is CPIC's relationship to the FDA, and how does that relationship affect reimbursement for testing? I mean, it's everything is intertwined together. It's a massive web.
Yeah. So we'll keep it brief. I know I don't want to keep it too long, but if you don't mind, Becky, I can just say very briefly CPIC or CPIC. That's CPIC. It stands for Clinical Pharmacogenomics Implementation Consortium. I almost wish they had come up with an easier acronym I can always remember on top of my head. But really, I think they started in 2009. Does that sound right? 2009, yes. I think it was 2009. That's when they established this, because they saw there was a lack of specific guidelines on how to adjust medication based on the generic report they were seeing. So a lot of labs were coming up with their own little, based on a lot of research and papers they were reading, they were coming up with their own what do you call it?
Annotations, clinical annotations.
Yeah. Mm-hmm. So there had to be a uniform way, and everybody was going to go to a guideline, right? We have blood pressure guidelines, we got diabetes guideline. So that's where the rationale for forming the CPIC and realizing there was a need for it started back in 2009. So yeah, that's all I can say about that.
All right. We can make a whole episode out of that.
So yeah, it's really important. I go there a lot. Daily look up things. There is a really cool CPIC I have it so bookmarked that I don't even know the website, but I think it's cpicpgx.org is what it is.
I believe so.
Yeah. Yes. So yeah.
So to wrap up, I guess today's topics, just coming to you to let you guys know that we realize that you need expert advice beyond the certificate program. We told you a little bit about how you might pick your certificate program, to get your basics, get get that certificate under your belt. We talked high level about business models and what you need to think about when you're considering starting your own business versus working with another entity in the pharmacogenomics industry.
Yeah.
And then,
market research. Yeah.
That's right. Market research. We talked about your understanding of pharmacogenomics and how you need to be able to master pharmacogenomics before you're trying to sell it to someone else.
Yeah. And the last thing would be your audience. Your audience are 3 people: clinicians, patients, payers. And so like Becky was saying, document your outcomes. Outcomes is where it matters. If you're impacting patients and helping clinicians producing outcome, that's where you really can say, you've done a good job with, moving the PGX forward, right? That's where we're trying to go, right?
Yep, absolutely.
Yeah. So thank you, everyone, for tuning in, and make sure you don't miss any of our episodes. Don't forget to share this link so everyone can stay tuned and listen to PGX for Pharmacists podcast on Convey Med. There is no other place to go for all your PGX needs. We do a lot of PGXing on here. So the science, the business, the reimbursement. So leave us a review on Apple Podcasts or Spotify. We love to hear from you. And you can also visit us on PGX4, the number 4, rx.com to listen to all our episodes. Thank you, Becky. And we can call after the podcast so we can talk more.
Absolutely. All right, you guys, catch you next time.
Thanks for your interest in PGX and for spending some time with us. Please share this podcast and leave us a review on Apple Podcasts or Spotify. For all of our episodes, please visit pgx4rx.com. That's pgx4rx.com.